Hello everyone, I am Dr. Sanjana from Science Academy. Today Science Academy is going to discuss with you an important topic, that is nutritional neuroscience. Nutritional neuroscience related to ADHD. What is nutritional neuroscience? It's an emerging field of medicine where nutrients are studied in related to diseases, and the role of nutrients in relation to the occurrence of diseases or the causation of disease, progress of disease, etc. are studied here. It is also studied along with the food additives. The role of food additives on nervous system or neurons is studied by nutritional neuroscientists, and the topic of discussion is the role of nutrients on ADHD. We know that ADHD is a neurodevelopmental disorder and it is not a nutritional disorder. However, nutrition also has some role in ADHD or the progress of ADHD, and we know that nutritional aspects of ADHD is related to neurotransmitters. Before that, let's have a glance at the symptoms and signs of ADHD. ADHD is a disorder, neurodevelopmental disorder with three components, that is inattention, hyperactivity, and a combination of both. Sometimes ADHD may be present with the lack of focus in children or inattention in children. Sometimes with hyperactivity, fidgetiness, violence in children, and sometimes it may present with the combination of both. And these three are the major presentations of ADHD. In addition to this, ADHD can have association with other diseases, other neurodevelopmental disorders, as well as neuropsychiatric disorders. ADHD may coexist with autism spectrum disorder and ODD also, defiant disorder, and it may have other neurodevelopmental disorders and neuropsychiatric disorder in association. So it is very important to diagnose ADHD, whether it is pure ADHD or a combination of or a comorbid association is there. If there is any comorbidity in association with the ADHD, that has to be illustrated or elucidated clearly very well. And ADHD symptoms are often related to the grades of ADHD. Sometimes mild ADHD, sometimes it may be severe ADHD. In mild ADHD, there will not be much problems. It get unnoticed in the childhood, and sometimes it may present in the adulthood. So ADHD in adults may be presenting as if it is occurring for the first time. But ADHD was there in the childhood itself, but it may be unnoticed because it was so mild. But severe ADHD may be associated with severe symptoms of hyperactivity, inattention, etc. All these are the symptoms of ADHD. I don't go into the details of ADHD. Instead, I go straight into the nutritional aspects of ADHD. That is the topic of discussion today. So let's have a glance at the factors, nutritional factors related to ADHD. ADHD and neurotransmitters. Neurotransmitters such as dopamine, epinephrine, norepinephrine, histamine, etc. are produced by some nutrients. Some nutrients are very crucial for the production of these neurotransmitters, and they include vitamin B1 and B6. And some amino acids are also important, such as tryptophan. And vitamin B1, thiamine, has a crucial role in ADHD children. So deficiency may cause problems with the neurotransmitter production, and neurotransmitter metabolism is also impaired by the deficiency of vitamin B6 or pyridoxine. Okay, and another important nutrient associated with the cognitive function is omega fatty acids. Omega fatty acid does not have huge role in ADHD, but it has some role in ADHD because it is related with the cognitive. It is more related to cognitive function of brain. Cognitive functions of brain means memory, concentration, and comprehension, etc. The ability to understand things. So it is more related to comprehension and cognitive brain functions. However, 1 to 2 milligrams of omega fatty acids are very important for children as well as adults per day. And omega fatty acids are abundant in fish, small fishes such as sardine, tuna, mackerel, etc., and salmons also. And next important item is vitamin B1. As I mentioned earlier, vitamin B1 thiamine is present in the cereals and brown rice. It is present in some fruits and some seeds and nuts. And vitamin B6 pyridoxine is present in pineapple and orange. It is present in legumes and seeds and nuts. And another important mineral related to ADHD is iron and zinc. Iron is very important in optimum amount. However, iron supplementation is not recommended in ADHD if there is no anemia. And even if there is anemia, it should be prescribed by a doctor or a healthcare provider. And zinc also is very important, but excessive intake of zinc or iron is not at all recommended by anyone or any studies in ADHD. Optimum amount of iron and zinc is crucial for all, including people having ADHD. So we should incorporate food rich in iron and zinc, such as seafood, legumes, seeds, nuts, broccoli, spinach, etc. And omega fatty acid, we have already mentioned about it. Now thiamine, we mentioned about it, the sources of thiamine and pyridoxine. All these are very important nutrients for managing ADHD. And intake of nuts, especially pistachio. Nuts are very important for children having ADHD, and because it's rich in vitamin B6. And next is the role of nutritional neuroscience in ADHD. Nutritional neuroscience is an important field of medicine, and with the great implications in neurodevelopmental disorders. An emerging field of medicine. More researches are going on in nutritional research. It is also related to nutritional psychiatry and some nutraceuticals. Nutraceuticals are supplements such as vitamins and minerals with some herbs. And some nutritional nutraceuticals are made by scientists, and they are under study, and some are available in the market. However, the exact efficacy of these nutraceuticals is still under study, and so better we take all these nutrients through our natural food. I always recommend it unless there is some deficiency. So excessive intake of iron or zinc is not at all recommended in ADHD or in other disease. Zinc is a toxic substance, so zinc is not recommended as supplement in ADHD. Iron also is not recommended as supplement unless there is deficiency. Zinc is given by some doctors if there is zinc deficiency, and it is given along with some tablets, that is in combination with some medicine. Zinc is given if some medicines cause depletion of zinc. Otherwise, zinc is not recommended as a supplement. Zinc causes toxicity. So for proper functioning of brain, you should include zinc, iron, etc. through foods such as seafoods, legumes, nuts, seeds, broccoli, spinach, and some fruits, and vitamins also. That's all about nutritional neuroscience related to ADHD, or the implications of nutrition in ADHD. Keep on watching Science Academy, and to subscribe and share our videos. Keep on watching. Bye. Have a nice time.